Now we'll quickly look at the aspects of foundation exposure techniques. So for foundation exposure techniques and also the charts, this is what actually helps radiographers to now get to say that, okay, for this particular patient, this is the amount of exposure the patient will need. This is what the patient will need. This is what the patient will need. Do you understand? They help in decision taking, you know. So foundation exposure techniques and also charts in radiography. So they just have to do it. They are what helps radiographers to be able to now select, you know, the correct combination of what kilovoltage, milliamperes, and also try to decide that, okay, for this particular patient, how long should the patient be exposed to some particular, you know, radiation energy and the rest of it. Okay, so overall they help it that what at the end of it, the patient is the radiographer is having very good images that will now help for the diagnosis of whatever condition in that particular patient. So for the foundation exposure techniques include all those manual technique selections, all right, where the radiographer will just choose the amount of light to use, how long you use the light, and he's making that decision based on what he's looking at, the patient size, the patient anatomy, clinical need, you know, this kind of thing. So this one usually comes, like the accuracy usually comes with experience. So a radiographer that has been imaging this type of patients will just automatically know what to do, you know, and all of that. Then we have the automatic exposure control. This one, you're using all those radiation dictators to be able to what they're usually placed behind the patient to be able to, you know, they'll be there. So they'll be imaging. So probably when any other thing is out of proportion, they just stop it automatically, you know. Then we had anatomically programmed radiography, where you have all those computerized systems and the radiography selecting the body parts and also the projection on the console. Then we have the pre-programmed exposure factors, okay, where everything will now be fine-tuned, and it just simplifies the workflow and also standardizes what the techniques. So exposure technique charts, we have exposure charts are reference tools that guide radiographers in selecting exposure factors. Okay, so we have all those fixed KVP charts. Okay, so KVP is constant for a given body part. Mass is adjusted based on the patient's thickness. Do you understand? So a lot of things, you know. So we have the variable KVP charts too, where KVP changes with patient thickness, while mass remain relatively constant. Then we have the high KVP charts. It's used for those chest imagings and barium studies. Then we have specialized charts where they will now apply it if you are dealing with children patients. They also apply it when you are dealing with old patients, and depending on the patient's condition solely though.